Welcome back, it's Buck Joffrey here again with Dr. John Bridger of Santa Barbara Podiatry.com. He is the foot doctor in town here for Santa Barbara, Montecito, Goleta, even Solvang. Carpinteria too, I think, right? Anyway, if you've got a problem with your feet, this is the guy to see. So thanks again for answering all of our questions.
Of course.
So, Dr. Bridger, let me ask you this. When sometimes you hear about people, you know, I know from being, from knowing a lot of active people, I've known some friends who've had problems with their Achilles tendon.
Right.
Well, first of all, what is the Achilles tendon? Let's look at this and
let's take a look. I can explain first what the Achilles tendon is. So this is a left foot model, and here you can see the heel bone. Of course, you can't see the tendon. This is just the bones, but you can see this ridge here, and actually extending all the way down to here, you have the attachment of the Achilles tendon, which is a strong, powerful tendon that will basically pull your foot down, pulling it down in this motion. And that's really important when you're walking. If you think about your weight and propelling it forward, that's required every time you propel your body forward with every step. And what can happen is, and most typically due to overuse, is the tendon begins to fray. And that most commonly occurs either right here at the insertion or a few centimeters up here. And that can be very debilitating, preventing you from either extended activity or, when it gets more severe, even daily activity.
So what does it feel like when you start fraying at that tendon, which, by the way, is attached to the calf muscle, isn't it?
Exactly, yeah. So the Achilles tendon comes from the calf muscle and the gastroc and the soleus muscle.
Right.
So
basically it's what's actually attached to the bone that attaches the muscle to the bone.
Exactly.
Right, and allows for the movement. So when that thing starts fraying, how do you feel it? Or does it happen suddenly? Does it, you know, are you playing basketball and all of a sudden you fall, something like that?
So it can happen suddenly. That's usually a rupture of the whole tendon.
Oh boy.
Right,
Yeah.
and so that's what you want to avoid. It usually starts by kind of a dull ache. Sometimes it can be worse with activity, but sometimes you don't notice it with your activity. You're too busy playing basketball, running around, playing tennis, and you notice it later in the day.
Where do you feel it? Do you feel it right in where the tendon is, or does it shoot down somewhere else?
It doesn't usually shoot down anywhere. It's usually right in the back of the heel. Sometimes it's a little higher, but usually not in the calf muscle. It's closer to the heel.
Okay, got it. And then does it get better when you rest, or is it the type of thing that, you know, kind of happens even when you're resting?
So this is one of those problems where it's often exacerbated if you haven't stretched enough, you're not doing a regular warm-up, and it can go away if you dramatically decrease your activity, but just like so many foot problems, that is never the answer, right?
Right, especially for active people, because this is something that presumably a lot of active people get, and the last thing you want to do if you're a runner is stop running.
Right.
Right?
Yes.
Yeah, so what do you do? I mean, when you start noticing this, you know, when do you know it's time to potentially come and see you?
So if this is affecting your activity in any way, one of the first steps with any of these, any foot problems like this, like tendinitis, you want to make sure you have a good supportive shoe. And it's good to wear that even at home. Avoid barefoot walking, and that's the first step. And if you can't get better with that, then it's time to go get it looked at by a professional.
Right. So when you say good supportive shoe, tell me what that means exactly. I mean, obviously you're not going to, you know, for women it's not heels.
Right.
But what's a good supportive shoe? What do you consider a good supportive shoe?
So it can depend a little bit on the problem that you have, but having a shoe, a typical like a gym shoe, sometimes a shoe with a little bit of a heel can actually be helpful as well. So for women, a lot of times a clog can be a great option. And then when you're having pain due to tendinitis or pain in the joints, oftentimes a more rigid shoe that has less bend to it can be very therapeutic, because the tendons and the joints in your foot, they don't move as much when you have a more rigid shoe. So that can be a great option if you're having pain.
So if this thing keeps fraying and you're not doing anything about it, it could rupture. It could just rip apart.
Yeah, so sometimes, you know, people will hear a pop, And when that happens, you need to seek treatment immediately.
Yeah, so that can happen to people who are less active and more than athletes as well, or is that?
Yeah, so it often occurs when you increase your activity. So that could be from a desk job to working out on the weekends, or it could be from running 10 miles a day to running 20,
Wow. And if that happens, you need to see somebody right away. There's no question about it, right?
Exactly.
Just can't even walk.
Yeah, so sometimes you can get up and you can get around a little bit, but that tendon needs to heal in the proper position. And so typically, even if you are a trooper enough to get back up, you need to get it checked out immediately.
Yeah, and would that require surgery?
So that does sometimes. There's some more research that actually says that by casting it in position, sometimes you can heal it without surgery. So depending on how severe it is and your level of activity, that'll decide whether you're the best candidate for surgery or one for casting.
Well, we certainly don't want it to get that far,
right?
So if we've got this kind of problem, how do we get a hold of you?
Yeah, so the best way to get a hold of me is through my website at santabarbarapodiatry.com, and you can see the link below, and you can make an appointment, and I can treat it for you right away.
Thanks, Dr. Bridger.
You're welcome.